Go.
Hi, good afternoon. It's Dr. Jenny over at Four Paws at Fulshire Veterinary Clinic, and today Maddie and I are going to chat a little bit about canine or dog preventative care and why it's so important.
Dr. Denny, what does preventative care do for my dog?
So preventative care is exactly what it says it does. We are trying to prevent disease. We are trying to catch disease early. That way we're preventing a not good outcome. So our whole cornerstone here at this practice is preventative medicine. I believe so strongly in it that we offer senior sneak peeks with yearly labs, and that's a 4-quad adult ultrasound scan, and it's basically looking for things that could be treatable or preventable. And if we know that there's these problems, we can intervene a lot faster. And what that's going to do is your dog is going to live longer and have a better quality of life. And that's, for those of us that our pets are our family or part of our family, which if you're watching this video, you're probably one of us. My animals are so close to my heart. I don't have children. So a lot of those maternal instincts go on my pets, but preventing disease, preventing illness, or catching disease or illness before we have symptoms is huge. That's why our pets are living longer. That's why they're living better quality of lives, because the focus of veterinary care isn't just on fixing a disease once it's happening. It's focused on catching it, finding our risk factors, and if we're high risk, watching for it. And if we know that there's an early start to a disease but there's no symptoms, we're going to address that before we have symptoms. I mean, how great has medicine become where we can have preventative medicine and preventative care to allow our older pets to live longer and have better quality of life.
Is preventative care less expensive than treatment?
So I think that it is. I 100% think it's a lot easier to catch a disease early in the stages than to have to, be tackling a grease fire. So it's a lot easier. I make this analogy in examiners all the time that, if the house is on fire, okay, that's the house fire. Okay, so that's like a disease and we're symptomatic, and now, we're fighting with everything we have to put this house fire out. Well, what if we just had a fire that was in the sink, in a pan, and all we had to do was just put the top on the pan? It's a lot easier and it's going to be less expensive. So the similar properties are going to go towards veterinary medicine. So if we're doing annual lab work, we're catching things early. We're catching things before it's bad, so we don't have to do as much. Some of these diseases, if caught early, are really easily treatable or manageable, and it's much cheaper to treat a disease before we're full-blown symptomatic than to wait until the house is on fire. I make that analogy a lot with my feline patients too, because cats are so good at hiding their disease, and dogs can be too. I talk about how dogs, when people come in and their dogs are super sick and they're like, well, he was fine yesterday. And what I'm going to say is he wasn't fine, but his body was compensating for his disease to the point where it was like a seesaw. So we had, if you think of a seesaw, there's a little fulcrum in the middle, and some people you've got one person on either side, and when you're both standing there, you're level, right? So that is when the body is compensating for the disease, so you don't see symptoms. But what happens if one person steps off? Whoosh! And that's when the body can't compensate anymore, and that's when these symptoms can come on hard and fast, and it can seem like something just happened overnight. So annual lab work, annual exams, even in our geriatric patients coming in every 6 months to get them examined, things change, and catching it early is going to be much cheaper and better for the pet and carries a better prognosis versus, a pet that comes in that's acutely ill, especially if they're older. And, what if it's a mass on the spleen that's bleeding internally? That dog might need surgery, but what if we don't make it? And what if 6 months earlier we had been in for an exam and maybe we couldn't have palpated the mass because maybe it was small then, but if we would have done a senior sneak peek and done some ultrasound screening, what if we would have caught it 6 months ago and we would have done surgery, and then we wouldn't have lost that patient? So that is the cornerstone of preventative medicine, is trying to make sure that those bad things don't happen.
What illnesses are staved off by good dog preventative care?
Everything. So I think that's a great question, but it really is everything. being on flea and tick prevention is going to prevent, flea bite dermatitis, which leads to skin infections. Tick prevention is going to make sure you don't get tick-borne diseases. Annual lab work is going to make sure that we know we have good health baselines and we know what your dog's normal is. Getting vaccinated, keeping up with your vaccines is going to make sure that your dog has a better chance of fighting off a deadly disease if it comes into contact with it. So, preventative care, it's making sure that your dog's going to be healthy. So, I think everything I think is the answer to that question. I hope you guys learned some things while we sat down and had this little talk. If there are additional questions that you might have, please feel free to give the clinic a call. Thanks.